Good morning, everybody. Welcome back. Happy Monday. I hope everybody had a wonderful weekend and now you're refreshed and coming back to have a few more sessions this week, 2 each morning, Monday, Tuesday, and Wednesday of this week. Lots of really great content as we did last week. I hope you enjoyed our sessions last week and our speakers. We're so pleased to have them all. And we have some wonderful speakers today and the rest of this week as well. So a few announcements and just some information this morning before we get started. And we will be starting at 9:15, so just a few more minutes here. And as you saw in some of the opening slides, we are so thrilled. This is our largest attendance for this conference yet. So thank you for joining us, for being a part of this. I think last I saw, we were up to over 377 total registrants. I think we have actually gotten some since then, which is fantastic. And of those, we have some 50 at least who signed up just for pre-licensing. Those are the folks that many of whom are new enrollment assisters. So congratulations to you for starting on this journey. And then over 200 are doing their continuing education. So we're so pleased to have you. We know that it's an endeavor each year to get those credits and to continue to be able to provide this enrollment support. Of those who are attending our conference, most of them have never attended before. So thank you for joining us if this is your first time. We have a similar, though slightly less number who this is their up to third year attending. And then 59 have been attending for between 4 and 7 years, 28 between 8 and 9, and then 48 have come every year. We've been doing this for 10 years, since 2014, so thank you. Or actually, excuse me, 2013. We have 70 towns and cities represented around Wisconsin, and then 141 unique agencies represented, which is just fantastic. It also just shows the breadth and diversity of the stakeholders that attend this conference and that look to this information to help them in their work. Just a reminder that we are going to be doing a gift card recipient drawing in just a moment here. Let me just take a look. We will also reminder that we have sponsors who are doing virtual exhibit booths every morning between 8:15 and 8:45. So you just need to enter the platform just a little bit early. So if you want to check those out and meet with them, ask questions, and learn more about their services. And we will be doing an evaluation. Pre-licensing folks hopefully have already received theirs for the content earlier last week, and then we'll be having an evaluation for the remainder of the conference that cover all the conference sessions, and we'll send that out on the last day on Wednesday. So now to our gift card drawing. So this is for attendees from last Friday. And the gift card drawing recipient, so this is a $50 gift card, will go to Tashonda Hunt. So congratulations to Tashonda. And we will be sending you information after the conference to confirm that and let you know what else we might need from you in order to be able to send that to you. But again, Tashonda Hunt, congratulations for that. We will be doing another gift card drawing tomorrow and then 2 on Friday. So with that, we're going to take another pause and we will be starting our first session right at 9:15 or so. So thank you, and we'll see you in just a few minutes. Wonderful. Well, we're right at 9:15. We're going to go ahead and get started with our first session. And I'm so pleased to introduce this session's moderator, Sashi Gregory. So Sashi currently works for the Wisconsin Primary Healthcare Association as a policy and research director. She loves working with and learning from Wisconsin's community health centers as they work to provide primary care and more to some of the most disenfranchised communities in Wisconsin. Prior to her position at WIPCA, she has worked in Medicaid policy and advocacy at the federal level and as a policy advisor for the Michigan Medicaid program. In her free time, she enjoys spending time with her husband and 2 daughters, learning how to play cricket, long walks with her dog Daryl, and gardening. Thank you so much, Sashi, for doing this, for being here, for lending your expertise and knowledge, and for opening this session and welcoming our presenters. So I'll hand it over to you.
Hi, good morning, everybody. Thanks so much, Allison, and thanks for having me as a moderator. As Allison said, my name is Sashi Gregory. I'm the Director of Policy and Research at the Wisconsin Primary Healthcare Association, or WIPCA, as we like to call ourselves, because quite a mouthful. WIPCA is the member association for the 19 federally qualified health centers or community health centers in Wisconsin. Our members are spread across the state and are located in communities that have low access to care. And our clinics provide care to anyone despite their ability to pay. Of the over 280,000 individual CHCs served in Wisconsin, 60% are Medicaid beneficiaries, and approximately 20% don't have any insurance. Our community health centers provide primary medical care, dental care, and mental health care almost all the time in the same clinic as well. And we also provide substance use services. Health centers also provide enabling services, so these wraparound services that seek to assist individuals beyond their clinical care and kind of help with those social determinants of health. Part of these enabling services include kind of a really nice, robust outreach and enrollment service network for health insurance. And with the majority of our patients on Medicaid, being active partners in the state's unwinding process is really important for our health centers and for the communities that they're serving. Part of my work at WIPCA is helping our health centers prepare for the unwinding, including that and everyone at the health center, from the front desk staff to the back office billing to the providers, understand what unwinding is and why it's important to their role in helping patients through their process. I also work with our CHE outreach staff with the wonderful Julia Garvey, who is our eligibility and outreach consultant here at WIPCA. And, we're hoping to review and interpret some of the findings that the state data sources are going to be helping us with. And one of our speakers will talk about that a little bit more. And just trying to figure out where health centers need to target their outreach and communications in response to the needs of the populations that they serve and some of those special communities that they serve as well. And like the majority of you at this conference, our health center staff are at the front line, or the on the ground individuals who can really see before even any of the data comes out from the state, where there's issue, where there's barriers, where patients are just struggling with the process. So their care and knowledge of the people in our health center communities and their expertise in this eligibility process and the enrollment process is so important to the unwinding process and even beyond. And it's such a pleasure to be able to work with our outreach and enrollment staff at our community health centers. It's also been a pleasure to be working with our 2 panelists today, Tricia Brooks from the Georgetown Center for Children and Families in DC, and William Park Sutherland from Kids Forward here in Madison. I actually got to work with Tricia when I was working at Kids Forward, and I've actually had the pleasure of working with many of her colleagues at CCF when I used to work in DC on Medicaid and CHIP advocacy. Her knowledge of the intricacies of Medicaid and CHIP eligibility and enrollment and kind of all those administrative processes really can't be beat. She's really the go-to person for those. She's also just a tireless advocate for ensuring children and their families have the best access to care possible. Tricia is a research professor at the Georgetown University McCourt School of Public Policy Center for Children and Families. It's a nonpartisan research center with a mission to expand and improve health coverage for children and families. At CCF, she focuses on eligibility, enrollment, program administration, and the quality of healthcare related to Medicaid and CHIP coverage for children and families. Before she was at CCF, she served as the founding chief executive officer of New Hampshire Healthy Kids, a legislatively created nonprofit corporation that administered the state's CHIP program and managed the Medicaid and CHIP Consumer Assistance Hub. Tricia was appointed for a second term by the Comptroller General to the Medicaid and CHIP Payment and Access Commission, or MACPAC, which is an independent commission that advises Congress on issues affecting Medicaid and CHIP. She has also served as faculty or as a technical advisor, group member on a variety of initiatives associated with advancing Medicaid and CHIP coverage for children and families at the national level. I've also had the chance and continue to get to work with William, whether it's advocating for better access for insurance and healthcare for Wisconsin's families and children, or serving on the state's outreach and enrollment data work group together. William's passion for advocacy for better access to healthcare for children and families is always inspiring. And I always learn about something I need to be paying attention to a little bit better, given his deep knowledge of current state and national policies affecting this access. William works as the health policy analyst at Kids Forward, and in his role, he works to protect and expand access to affordable, quality health coverage and care, especially for those impacted by health disparities and in cycles of poverty. He helps Kids Forward strategize paths to advance health equity in Wisconsin and move toward a system with universal access to health care for all. Previously, William served as executive director for a mental health advocacy and peer support organization where he engaged policymakers, providers, and other stakeholders to build power and create just mental health policy. So thank you both, Tricia and William, for sharing your time and expertise this morning. I'm going to go ahead and have Tricia kick us off. And I'm hoping she can start us off with the latest and greatest developments with the Unwinding process at both the national level and how Wisconsin's doing compared to our Midwestern neighbors. Thanks so much, Tricia.
Thank you, Sashi, and good morning, everyone. I want to give you a little anecdote about William because it wasn't in the bio read, and that is he is a super, super nice guy. At our annual conference in June, CCF had an outdoor venue. It was cold, windy, rainy. Dan Sy, the federal Medicaid director, was presenting, and he said, boy, it's really cold up here. And then he said it a second time. And William took off his jacket and gave it to Dan so Dan could continue to present. So we'll add super nice guy to William's bio there. But let's dive in here. It's really a pleasure to be with you today to talk about the unwinding of the continuous coverage requirement. I know that all of you are aware of what has been going on. And as Sashi alluded to, I'm going to talk about three things today: the current status of the unwinding, federal monitoring and oversight, and what's ahead. You can go to the next slide, please. And then one more. We're going to start with the current status of the unwinding from a national perspective and how Wisconsin compares. So all states are processing renewals, and as of July, all but Oregon are processing disenrollments. Next slide, please. Now I'm going to be talking a lot about the data reflecting the renewal outcomes, but first, let's take a look at the themes and issues that are bubbling up. Honestly, we could have drafted the chapter on concerns in advance because most of these are long-standing problems like notices. I've been working in the health coverage space for 30 years, and the lack of clarity in notices has always been a problem. We're also hearing about mail delays where it takes 9 days for a piece of mail to arrive across town. Enrollees and assisters report long wait times at call centers, dropped calls, and lack of language access, as well as systemic and specific eligibility errors. Low ex parte rates and high procedural disenrollment rates are predominant, and we're going to talk a lot about that. And just in case anyone is unfamiliar with the term ex parte renewals are conducted automatically by the state's eligibility system using external third-party data, such as state wage data, unemployment compensation, and other information from reliable sources like the Social Security Administration. Ex parte renewals are administratively efficient, cost-effective, and accurate. And the higher the ex parte rate, the greater likelihood that eligible people retain coverage. We also know that parents may be confused about their child's eligibility when they're no longer eligible. And even when stakeholders advocate for mid-course corrections, some states are slow to take action. I want to focus on this last point. Lack of awareness of the 90-day reconsideration period. This is important if you work in outreach. Anyone who is disenrolled from Medicaid for procedural reasons can submit forms or documents needed to have eligibility reviewed. And in some states, coverage will be restored retroactively back to the date of termination. Now, that's a lot of negatives. There are also positives. Many states had flagged as potentially ineligible are actually retaining coverage. And CMS dug really deep to offer temporary flexibilities for states, such as leveraging health plans to assist with outreach and renewals to smooth the unwinding process. And states have taken up many of these options. Many states are being transparent and posting their own data when it is submitted to CMS. And some states have even paused disenrollments when they were concerned about the number of people losing coverage. And in all of this, states are making positive long-term system improvements. Next slide, please. Now, I know you can't read this graph, but you'll find the link listed, and I know these slides are going to be posted later on. The Kaiser Family Foundation and Georgetown CCF are both tracking and posting unwinding data in real time. Now, there are some differences in our sources. CCF is only using renewal outcome data that states submit to CMS, while KFF, or Kaiser, is also pulling data from state dashboards that may not align with CMS data reporting requirements. But based on the KFF data, so far, 6.6 million people have been disenrolled in 48 states, out of just under 22 million renewals due. That's a 31% disenrollment rate, with another 19% of renewals pending action. If this trend continues, more than 27 million people could be disenrolled compared to prior estimates of 15 to 18 million. Next slide, please. And what's really discouraging is that only 26% of the 6.6 million disenrollees were determined ineligible. 3 out of 4, or 74% of all disenrollees, lost coverage for procedural reasons, although many may re-enroll in the coming weeks or months. Later on, I'll talk about how we might be able to track re-enrollment. It's also important to note that not everyone who is procedurally disenrolled remains eligible. People who have obtained other coverage or know their income is over the limit may choose not to respond to the renewal. Next slide, please. This is a particularly vulnerable time for children. Eligible children are more likely to lose coverage at renewal than any other time. And the lack of communication between states and enrollees during the pandemic only compounds the problem. And there was a recent bombshell dropped by CMS that states aren't correctly processing ex parte renewals, which is impacting children the most. And this will definitely exacerbate the problem. And I'll talk more about this in a moment. Next slide, please. But first, we already knew, based on research by the Office of the Secretary, Assistant Secretary of Planning and Evaluation, that 3 out of every 4 children losing coverage would remain eligible, compared to 45% of enrollees overall. Next slide, please. And people of color are also at higher risk for procedural disenrollments, with more than half of Latinos and just under 50% of non-Latino Blacks experiencing a loss of coverage due to procedural reasons, compared to a 40% rate for white non-Latinos. Next slide, please. Now, How will we know if people who were disenrolled for procedural reasons are re-enrolling? Intel from the field suggests that call centers are often telling individuals they must reapply rather than just simply submit the missing forms or documents. Additionally, some states shut down the ability of enrollees to submit needing information through their online accounts after termination. But regardless of whether an individual submits information during the 90-day reconsideration period or submits a new application, it will be reported as a new application. Now, CMS reports state-level application volume on a monthly basis, and tracking and trending these data may indicate increased activity that likely includes re-enrollment. And a few states like Arizona have actually chosen to provide these data directly on its Unwinding dashboard. Next slide, please. So let's take a closer look at Wisconsin. These are the data the state posts on its website. So far, the cumulative share of people losing coverage, 48%, is slightly higher than those that have retained coverage, 47%, with a small share of renewals in process. Now, let's see how Wisconsin compares to neighboring states and across all states. In these next slides, the gold bar represents the best state and the red the worst state, with the dark gray bar as the median. Wisconsin is shown in green and neighboring states in blue. Next slide, please. So we're going to start with coverage retained. In looking at neighboring states, we could only report Michigan and Indiana, as Minnesota does not report data consistent with other states, and CMS data for Minnesota and Illinois are not yet available. But as you can see here, Wisconsin is in the middle of the pack, along with neighbors Michigan and Indiana, as well as the national median. Next slide, please. But you see a different picture in looking at coverage ended. At 48%, Wisconsin has a much higher disenrollment rate than its neighbors or the national median, and comes closer to the state with the highest disenrollment rate. Next slide, please. A key difference between Wisconsin and other states, though, is that Wisconsin has a very low pending rate, coming in at 5% compared to the median across states of 18%. Now, pending processing can be a combination of things. It can be that the state has received the renewal and hasn't processed it. It could be that they pulled back a cohort of individuals, or it could be that any number of things in terms of what might be happening here. But a growing number of pending processing could indicate a potential backlog, but I don't see that being a problem for Wisconsin at this point. Next slide, please. But we definitely need more data. Data that states are required to report to CMS or be subject to an automatic quarter percentage point reduction in the federal Medicaid matching rate for each quarter. The state fails to report the required data. But that's not what Wisconsin is posting on its website. Both coverage retained and coverage ended can be broken down into two components. Coverage retained is a combination of ex parte or automated renewals and renewals verified through the return of forms or documents. As noted before, ex parte rates are efficient, cost-effective, and lower the rate of procedural disenrollments. Now, coverage ended consists of those who were terminated for procedural reasons, as well as those who were determined ineligible. And just to reiterate here, high shares of procedural disenrollments, one of the most concerning outcomes of the unwinding to date, suggests that many eligible people are losing coverage and could experience a gap in care or become uninsured. Next slide, please. Having consistent data to compare states is important, but with CMS delaying public reporting of data for several months, it doesn't provide the timely data for informed decision making. More than half of the states are posting data consistent with the CMS reporting requirements, posting the reports that they actually submit to CMS, or they're doing both. And Georgetown CCF uses that state posted data that conforms to CMS reporting requirements to track the unwinding in real time. Unfortunately, we can't add Wisconsin to that list because the state is not breaking out the retained and enrolled groups. Next slide, please. But eventually, Wisconsin data will be swept into the CMS release. But so far, CMS has only released May data, and Wisconsin did not start processing disenrollments until June. So we don't, although CMS has those June and July reports, they've not publicly posted those. And the first Wisconsin data won't be reported until the end of this month, and then it will only be June data. Next slide, please. So what additional data will we be able to see? We'll get those breakdowns I referenced earlier for the coverage retained and coverage ended. We will also see any cumulative pending renewals, which might indicate a state is having difficulty staying on top of the workload. State level data on application volume and the share of applications processed over 45 days will also be released. And CCF is taking a look at how to track that and report those data, since CMS is the only source for most states. We'll also see the number of overdue fair hearings pending, which is also another possible indication of backlogs. Next slide, please. Now I'm going to pivot to what CMS has been up to for the past couple of years. Next slide, please. For more than a year before Congress stepped in to delink the continuous enrollment requirement from the COVID public health emergency, CMS was working closely with states to offer technical assistance in a variety of ways through formal written guidance, FAQs, and all state calls and webinars. Recognizing that the unwinding would be an unprecedented event, CMS dug deep to offer states a variety of temporary waiver flexibilities to smooth the unwinding and engage additional partners. Some states, like neighboring Minnesota, adopted 10 or more, but Wisconsin is only using the United States Postal Service National Change of Address database to update mailing addresses without further verification. The state also has a mitigation strategy in place to remedy some issue it has in the ex parte process, but the release of the CMS data doesn't tell us exactly what that is. But the really big unwinding news was reported on August 30th, when CMS revealed that many states are incorrectly processing ex parte renewals. In a nutshell, if the ex parte process is unable to verify ongoing eligibility for one Medicaid enrollee in a household, no member is being automatically renewed. Instead, the state is sending a renewal form to the entire household. I think we can go to the next slide. There we go. Sorry about that. And so the state is sending the renewal form to the entire household. And if it's not returned, all members are being disenrolled, even if the state has information indicating that one or more members are eligible. Now, this mostly impacts kids due to their higher income eligibility, although it may affect others. CCF has also concluded that some states are not automatically determining a child eligible for a separate CHIP program through the ex parte process, and instead sending a renewal form to these families. And the Urban Institute estimates that 57% of children ineligible for Medicaid are eligible for CHIP, or will be, and enrollment in CHIP should be seamless. Now, states were required to assess their system and processes and report back to CMS on September 13th. It's our understanding that CMS plans to share the results of that assessment perhaps this week. And states with the problem will need to identify and reinstate coverage for those impacted. If a state is unable to do so, it will need to reinstate all household members. And the state must halt procedural disenrollments until mitigation strategies or system fixes are implemented. Next slide, please. Now, CMS noted 4 possible mitigation strategies for states that have this problem. The first option would rely on worker intervention to manually renew coverage prior to disenrollment. Now, this option really concerns me of all these strategies because it requires worker capacity that states lack and would absolutely be prone to human errors. The second option is that the state can suspend their renewal processing entirely, or at least for the affected groups, until it implements needed system fixes and operational fixes. And whether a state's able to do this really depends on the extent of the problem that they have. And this approach may be much more difficult than it sounds and will likely push out the unwinding well past the mid-2024 end date. Now, the third option is a great solution for children. States may extend renewal dates for children out a full year, and this would take care of the bulk of the problem and allow states to concentrate on the smaller and more diverse circumstances where others may be affected. It also pushes children's coverage into 2024, when states will be required to provide 12-month continuous eligibility for children, a current option that Wisconsin has not adopted. And there are always alternative strategies that a state can suggest that CMS must approve in order to accomplish the same end goal of correcting the problem. Next slide, please. But make no mistake, none of this will be easy. System and processes fixes require significant resources, planning, IT work, including design, programming, testing, and implementation, as well as updates to procedures and staff training. Communication with affected individuals will be a huge challenge, and states will need help in reinforcing messaging. And there will be additional implications for health plans and providers, not to mention additional work for eligibility and call center staff. But fixing this problem once and for all is critically important to reducing the churn that has plagued Medicaid, and is particularly important for children because access to health care is intrinsically linked to healthy development and performance in school. Next slide, please. But that's not all that CMS has been up to. Earlier in August, the agency sent all states an individual letter regarding compliance action on 3 metrics: call center operations, the share of procedural disenrollments, and the share of applications over 45 days. While the agency focused on these 3 areas, they emphasized that these are not the only metrics the agency is using to monitor the unwinding. The letter reminded states of new tools that Congress authorized for CMS to use that would require states to take corrective action if they are out of compliance with renewal requirements or be subject to financial penalties. Now, because the CMS letters were based on May data, it does not yet indicate any issues with Wisconsin, since the state did not process its first renewals until June. Next slide, please. So we're going to move into a few closing slides about looking forward. Next slide. No doubt, we will need to double down on outreach and assistance, and no one knows how to do that better than the people on this call. Many in this audience already know how working through trusted community partners is critical to reaching hard to reach and vulnerable populations. We know that targeting outreach and assistance to the uninsured makes the best use of limited resources. So in the same way, we need to target outreach and assistance to children and families losing coverage for procedural reasons. While it's not likely that this is much different from the traditional outreach focused on low-income children, LAP individuals, and rural communities, it would be most helpful if the state were to provide more insight into the populations being disenrolled for procedural reasons. Next slide, please. I'm not sure when we're going to get through this unwinding. We were hoping it was going to be the middle of next year, but I think it's going to be longer than that. But aside from that, there's the impending implementation of 12-month continuous eligibility for children that I mentioned earlier. And now that so much has been revealed about state lack of compliance with renewal requirements and how inaccuracies in how states conduct ex parte renewals are affecting individuals, CMS is requiring states to implement temporary mitigation strategies during the unwinding, but then they're going to have 2 years in which they have to have a plan that is implemented that is going to come into full compliance post unwinding. We've also seen how critical timely data is to rapid response and monitoring our public coverage programs. Robust and timely data reporting and transparency must be permanently institutionalized. States also have determined that many of the temporary unwinding flexibilities should be permanently adopted as state options. And we should, as stakeholders, collaborate on making that happen. Last but not least, we need to examine the lessons learned during the unwinding to make long-term system and policy improvements to deliver the promise of consistent and quality health care to those who need public coverage. Next slide, please. In closing, I just want to point out the importance of ongoing feedback loops, which are so critical to program improvements in both the short and long run. Assisters and providers are key sources of intel from the field, and by collaborating, stakeholders can provide feedback to the state and advocate for specific policy and system improvements. Collecting and sharing lived experiences makes it real, and the media can help create awareness of issues that puts pressure on state officials to make improvements. While feedback loops are particularly important when system or policy changes are implemented, like the unwinding, these collaborations encourage two-way communications, and they build trust, all toward the goal of improving the health and financial security of children, families, and low-income adults, which benefits us all. And my last slide just has some resources for you so that you'll have some links to some of the data that I've talked about after the presentation. And with that, I'm going to turn it back to Sashi.
Hey, thanks so much, Tricia. Just a note to everybody on the session, please use the live Q&A if you would like to type in questions right now. And I think we also have a choice to maybe raise your hand and ask a question as well. And then I believe there's a poll, or can I see the question? All right, here we go. Oh, we do have a question, Tricia, and it's from Adam V. Do you think that regardless of mitigation strategies states implement to correct administrative renewals, that it'll push out the end date of unwinding?
It'll be a state choice. I don't think states are going to be required to do so, but CMS has acknowledged that states, if let's say they pause for 2 months, that it's fine to add 2 months on the back end. Yes, I do think it's going to push out the unwinding. This has been my nemesis for a very long time now, and I think it's going to stick with us for a while.
Thanks, Tricia. And I also have a question from you, unless there's some from the group, which I can't see. Tricia, you talked a lot about kind of the issues with the ex parte renewals and administrative, and then kind of, it's going to take a while for the state to kind of implement these procedural issues and the policy changes. How can the state better communicate with our enrollment assisters and how they're going to help individuals through this kind of interim processes as with ex parte renewals and kind of the confusion that's going to be happening for so many families, right? With the letters that might be coming out.
One of the conundrums of the unwinding is that states have really stepped up and boosted their communications directly with families, but the research shows that a lot of people actually didn't know they had ongoing coverage throughout the pandemic. Some states didn't actually even communicate with people, did not continue to conduct ex parte renewals if they were able to. So we've got a really heavy lift ahead, but transparency and sharing information is really critical. If you ask the state what's going wrong, what are they doing to fix it, and they're unwilling to share that information, then you're sort of at a loss as to understanding what the next step is. And honestly, if a state helps me understand the problem they have and why it's taking so long to fix the problem, I'm going to take the heat off a little bit because they've been transparent with me. So I really think that the state needs to boost its communications with the sisters and providers and health plans in particular, and really lay out its strategy for moving forward.
Thanks, Tricia. Please keep putting questions in the live Q&A. And we'll also have time at the end after William's presentation too to keep going with questions. So I'll give a pause right here. Tricia, anything else you want to say about enrollment assisters and just kind of how they can communicate either to advocates or to the state about what they're seeing? I know you said specific examples or patient stories. What do you see maybe other states or other advocacy organizations have kind of used that enrollment assister information?
Yeah, I mean, I think that some states are trying, or some with sister groups, maybe navigators, could be a primary care association, are trying to collect more data. We helped to put together a template that primary care associations could work. We worked with NAC, the National Association, on this, where you could just go in and use a simple spreadsheet to track the different problems that you're hearing so that you can sort of see, wow, this is what's bubbling up most frequently. And that information can be shared with the state, and that can help to prioritize the fixes or the responses that the state has. So I just can't emphasize enough the importance of the stakeholder community. The feedback loop is legal services organizations, PCAs, provider groups, plans. All of those groups really need to be huddling on a regular basis, comparing notes to really come together with these are the primary or the most important issues in our state.
Thanks, Tricia. All right, we have a few questions coming in through the Q&A. Okay, so again from Adam, with Unwinding, there hasn't been a lot of talk about the requirement for states to do the 12-month continuous eligibility for kids. Could you talk a little bit more about that 12-month eligibility?
Well, unfortunately, the state's not going to have a choice now. So Wisconsin is one of about half of the states that does not offer 12-month continuous eligibility. Why do we think it's important? It's important because kids need continuity of care, access to care. And we know that we're better able to measure the quality of care if there is continuous enrollment. And honestly, most kids don't lose eligibility within a given year. So Congress, when it delinked the continuous enrollment requirement from the public health emergency, also said, guess what? We're not going to make this 12-month continuous for kids a state option. We're going to mandate that states put it into place. Now, we're still waiting on guidance from CMS on this, and it's a little frustrating, I think, for states that they haven't gotten that yet when this is coming up January 1. But the state's not going to have a choice in the future.
Thanks, Tricia. All right, we have a question from Lisa G. Are any states allowing assisters to reapply remotely to alleviate the hold/wait times for patients?
So this is something we've really tried to get CMS to move on. And as far as they have come, is that the only way the assisters can do this on behalf of individuals is if they are appointed as an authorized representative. And that authorized rep can be specific to just the renewal unwinding so that people don't feel like, assisters don't feel like they're taking on additional liability, and individuals don't feel like they're giving authority to assisters to do a lot of things, right? You can say, this is only associated with my renewal in this at this time period or something, right? But and you can do that without actually having a signed form. There's a waiver to do that without having a signed form. But I think this authorized rep requirement still remains an impediment to making that happen. And quite honestly, I'm frustrated that CMS hasn't moved more on that front.
Thanks, Tricia. right, Francisco Guerrero has a question. Do you think in the case of Latinos, the public charge misinformation is making Latinos not re-enroll in Medicaid?
We certainly know that public charge had a huge impact, a chilling effect on coverage during the Trump years. And I think we were beginning to pull ourselves out of that and get better, more positive messaging out to Latinas. But these higher procedural disenrollment rates really was based on 2018 data in terms of ASPE's projections. And so, yes, that data could have that. And we also know that there's still that lasting impact because now you have a lot of political rhetoric against migration. And so I'm sure it does, and it's going to take a lot. It takes that hand holding of Latinas to help them understand that they are entitled to the coverage, or their children are, and that they shouldn't hesitate to be enrolled.
Thanks, Tricia. All right, so Julia Garvey has a question. So regarding the 90-day reconsideration period, do we know if Wisconsin is applying the 90-day reconsideration? And if verifications are submitted after denial has been processed that makes coverage eligible, will the member need to reapply, or will eligibility be automatic? And then will it be backdated? And you should be able to see this question. It's a lot of parts to it.
I'm going to try to not interfere with my tech ability here and perhaps turn myself off. We don't know what Wisconsin is doing. This requirement's been on the books since 2014, this 90-day reconsideration period. We know that call center staff are not knowledgeable about it. And when someone calls in and says, I got this disenrollment, I think I'm eligible, I need to submit my stuff, they're saying reapply or file an appeal, as opposed to saying, here's the way to do it. So I think you got to ask the state if they're honoring it. We were shocked recently on a different state call where the state said, oh, this 90-day reconsideration is a new thing. We haven't paid much attention to it. It's like, no, it's actually not a new thing. The other problem, as I noted in my slide, is that some states are just saying in their online accounts, which where a lot of people renew, they shut that down, that they're not able to do that. So that's something that Wisconsin stakeholders should be asking the state about. Can people resubmit that information? But the state doesn't have a choice as to whether they're going to or not. They are supposed to do it in terms of federal requirements.
Great. Thanks so much, Tricia. I think those were the questions for here, but please keep putting your questions in the live Q&A as we move to our next panelist, which is William. And then I believe there's a live poll coming up too. Is that correct, Allison and others?
Yes, and I think Hannah and her team can post that. If attendees click on the live poll, it should be on your sidebar there. And once, let's see, I think I can even start it. So there we go. So I'll just go ahead and read that poll question. It asks, how closely are you following Medicaid unwinding data trends and news, either for Wisconsin or nationally? And the responses you can provide are very closely, somewhat closely, only a little, or not at all. And we'll give people maybe another, 20, 30 seconds, and then we can share them.
Sure. And Myrta, I see that you had a question about where Tricia works. Tricia works for the Georgetown Center for Community and Families, but she has been on some advisory committees for CMS and is also an advisor for the MACPAC, which is a nonpartisan committee that advises legislators on Medicaid and CHIP policy.
And if I can just add something here, I'd like people to know that CCF is completely philanthropically funded. We do not take money from industry or government.
Great. All right, Julia, thanks. You have another question before we move on. Tricia, would you explain or give an example of procedural disenrollment for the crew?
So procedural disenrollment occurs when the state needs more information and doesn't get it. So they are unable to make an eligibility determination. So let's say the state goes through the ex parte process, they send that renewal form out, it's not returned. If it's not returned, someone is going to be procedurally disenrolled because the state lacks information to affirmatively say that they are ineligible. And we knew procedural disenrollments would be high during the unwinding, but I think we're pretty shocked at how high it actually is.
Thanks, Tricia. All right. How closely are you following Medicaid unwinding? It seems we're at a good amount of people very closely, 43% somewhat closely. So most of you are following this at some level. Thanks for replying all. All right, so next to William. So like I said before, William is just kind of a tireless advocate here in Wisconsin for children and families, especially around healthcare access and equitable healthcare access. So William's going to kind of give us the Wisconsin view of what's going on and how Wisconsin has been working with stakeholders and partners to move through the unwinding process. So I will move it on to you, William.
All right, thank you so much, Sashi. Great to be with you, Trish. And I know I always learn something listening to Trish because she's got huge amounts of knowledge. And I guess I am a nice guy, but I gave my coat to Dan so we could finish his presentation because he was going to answer really important questions. So I had a little bit of self-interest there as well. So happy to be with you. My name is William Park Sutherland. I'm a senior health policy analyst at Kids Forward. You can jump to the next slide, please. So Kids Forward is a public policy research and advocacy center working to promote access to opportunity and remove barriers for families of color and others furthest from opportunity. Go to the next slide. So we use a community-driven approach to kind of understanding what's wrong and figuring out effective solutions that are system-based, right? So we're focused on policy and less focused on direct services. And most of our work kind of focuses in 4 main areas: early care and education, like childcare and like healthy eating and access to healthy foods, health and healthcare access and health equity, economic security and sort of tax and budget issues and sort of what we spend our money on and who we spend it on and what that means. And then youth justice, looking at kind of reforming the juvenile justice system and kind of the sort of decarceral movement around that. So for today, you go to the next slide. So for today, I'm going to be giving a sort of overview of the state's unwinding efforts since spring 2020, and a little bit of background and sort of rationale for why Wisconsin has taken on the pretty ambitious project of building a very useful dashboard that could really start to give us really actionable information and help assisters and others really understand what's going on and who's impacted. A couple disclaimers though. So this presentation hasn't been vetted by the Department of Health Services. I'm not a spokesperson for the department. I'm sharing this information, this is my best understanding based on my knowledge of the unwinding and my participation in kind of planning groups since spring of 2020. So just to kind of put that out there, if any of this is a little bit wrong or not quite right, or maybe not complete, this is sort of my best understanding of where we're at right now. Next slide. So this is probably something that a lot of you know, if about 70% of you are somewhat following or following very closely the unwinding efforts going on. But Wisconsin sort of has organized things. They have a broad, probably more than 150 member statewide unwinding task force. And there are a number of work groups that, this is sort of a hierarchical chart just to give you a sense of sort of organization, but I don't really think that there's a direct reporting that's sort of associated with this. But there's work groups related to outreach and communications, or there were, and kind of developing lots of the partner toolkits and the other materials. There's a work group related to data and analytics, which Sashi and I have served on together for a few years, and also sort of helped to co-design and develop the dashboard. There's a work group related to kind of income maintenance organizations and the county consortia and other partners in sort of just unearthing kind of what's going on, how things are working, what can be done better, what people are seeing in the field from the consortia perspective. And then I've never attended this work group, but I've heard it referenced a few times. There's a working group, particularly for HMOs and kind of understanding their role in the process. And, they play a very important and unique role in making sure that everybody has access to health coverage. And often they, are people who have good access to contact information. For some, they might be a trusted messenger, certainly, but they have a stake in the game for sure. And then there are actually 10, I think, in regional enrollment networks. So you can jump to the next slide. That are right here, and hopefully you can see this. There's a statewide Latino enrollment network, and I think on the intro slides, I just noticed that there's a statewide Hmong enrollment network as well. So that is great. You can contact Covering Wisconsin if you want to join an enrollment network, and I definitely encourage that you do that. It's certainly a great way to understand what's going on in your community, and there's an opportunity, for those concerns to be kind of filtered into those other working groups and up at the task force level, and then hopefully, potentially being able to be addressed by the department. You can jump to the next slide. So a little bit of the background of the dashboard in Wisconsin. So like I said, this began in 2020 with a partnership from the DHS OCI Healthcare Partnership, which actually I think formed maybe in 2019. So as soon as these continuous enrollment provisions came into effect, there was a group of people saying, okay, but how do we plan for when these end? Because we know they're going to end sometime and we need to figure that out. And the partners thought that this would be a really good opportunity to have a way to track actionable information that could support community level outreach and informed communication strategies to make sure that as many people as possible retain their Medicaid coverage or are connected to other options for coverage. And so that was sort of the genesis and the purpose of the dashboard in Wisconsin. The dashboard, kind of unfortunately, in my opinion, is limited to collaborators who we've all signed data use agreements. And the dashboard doesn't include any information on the renewals that Trish was talking about that are done through the ex parte process or the automatic renewals. You also probably hear those called administrative renewals in Wisconsin. Because the dashboard can get so granular, which I'll go into a couple examples in a minute, everybody who has access to the dashboard is required to follow kind of data security protocols and make sure that we are suppressing data that could potentially be identifiable if you sort of backtrack, because you can get pretty granular. And so you can go to the next slide. I'll give you kind of an example of what that looks like. So one caveat here is that you won't be seeing any real data. And I apologize for that, but this has been this is a very ambitious process. There's been some growing pains. There's been some kind of data loading issues. This is the first time that DHS has been in sort of co-collaboration with a whole bunch of stakeholders and provided this level of access to data. And so I haven't had time to confirm and make sure the data that we pull as an example is completely accurate. And we have in the data work group monthly meetings where hopefully we will begin to be able to do that as soon as everything kind of gets vetted. But the dashboard is tracking kind of three major categories. So Medicaid enrollments, Medicaid applications, and Medicaid renewals. It also includes only full benefit Medicaid enrollees. So that's Badger Care Plus, elderly, blind, disabled Medicaid, institutional Medicaid, and community waivers. And so that's where sort of like family care or IRIS would be. And then people who have Medicaid because they're on SSI. The really cool thing about the dashboard is that it can be filtered by all of these examples that I've given you here. So program, month, different kinds of geographies. So zip code, county, IM consortia, geographic rating region, race, ethnicity, primary language, and age. You can also apply multiple filters to really drill down. And so, as I said, this is kind of why you can get to a place where you really could kind of backtrack and get to a place where you might be able to identify somebody. So for example, you could look at Latino children in Brown County with a primary language of Spanish who were found ineligible for not taking action, right? So you could get at sort of that procedural denials for a very specific group, right? And so that's why I think, we have to make sure that we are taking steps to ensure that people can't be re-identified through that process. This is just a snapshot of kind of a training that we've had before. Just kind of showing you a little bit of what the dashboard kind of looks like, and an example, kind of you can see all the different filters and options that folks have. So go to the next slide. So, ideally, this dashboard could be used to help people kind of see what's happening in the future, see what they could expect, see how many renewals are due in a particular month. They could better target outreach efforts, both on the planning side and on a reacting side. So if you saw that there were a number of people who had late renewals who were in a particular zip code, you could target outreach efforts to that specifically, for an example. It also gives us an opportunity to understand systems gaps and disparities. So for example, if we saw that in one particular county, people whose primary language is Spanish were significantly more likely to be disenrolled for procedural reasons, that might mean not just that there's a larger systemic problem, but there might be some issues with capacity in a particular county, particularly county consortia, or some other issues. Or if we saw something broadly speaking, we might see that maybe there's translation issues with the renewal packet or some other kind of concern, right? Francisco, I think, asked about public charge. If we saw, for instance, a large number of people not returning the renewal packet, we might be able to infer or guess at that there might be something related to immigration status around that. It's also an opportunity. We'll have this data. This will be available throughout the unwinding. And so it really gives us sound data as a basis for advocacy and working towards systems improvements. And, Tricia mentioned that as well in her presentation, but it really is potentially really valuable information that we will have. So we will know, that, for instance, Black children are more likely to be disenrolled than white children. We might be able to find that out, right? And they're not ineligible. So we might be able to know what we could do to try to address that concern. So like I said, I'm sorry that I can't give you real data, but just sort of give you a sense of what this might look like. If you want to learn more about the dashboard, you can contact Covering Wisconsin. Covering Wisconsin has a representative on the data work group, and they can kind of put you in touch with somebody who's part of the data work group, maybe help you kind of understand, see what you could request. And certainly people on the data work group are there in part to be able to run reports and access the data, on behalf of our stakeholders, right? And so hopefully that is you. And when this data, starts to become available, hopefully the department will also be putting together reports so that we can understand this better and take action and make sure that as many people as possible have health coverage during this once in a generation unwinding, which is the worst possible name we could give it. But anyway, thank you so much, and I'm happy to answer any questions in the 12 minutes we have left.
Hey, William, thank you so much. Once again, please use the live Q&A chat box to put any questions in. They can be for both William and for Tricia. William, going back to Francisco's question about ex parte renewals and public charge and things like that, could you talk a little bit more about, kind of mixed status families and maybe how that might be kind of causing some issues here in Wisconsin?
Yeah, so I think another example where we might be getting into issues with who could be impacted by this sort of ex parte snafu that Tricia explained is where one family member needs to submit more information, potentially verifying immigration status or something like that, and another family member doesn't. And so that could potentially lead to everybody being sent a enrollment packet in the family, even though, for example, the child might be able to be renewed kind of automatically. And a disclaimer there is that Wisconsin hasn't, to my knowledge, said clearly that they're impacted by this process and how they're impacted and what their steps are. And so I am, just kind of guessing at that. And I don't think any of us know kind of exactly how Wisconsin's impacted and what its plans are moving forward.
Thanks, William. So we have a question from Adam. Do you think this data dashboard might continue after the unwinding? Are there other pieces of data well, let's start with that one and then I'll keep going.
Sure. Okay. Adam, I sure hope so. I think this has been like I said, there's been, some issues with kind of making sure that data is loading properly and that everything is working. And it's certainly a large beast, and I only gave you a tiny snapshot of it, but it provides a level of transparency into the Medicaid program that I think is probably unrivaled by any other state even. And certainly it's the most kind of collaborative process that the department has ever done that I've been a part of. It also, like I said, we really could use it to make data-informed systems improvements. And so I sure hope so. And I hope that advocates like you and others, when we see how useful this is, can lobby to prioritize resources to keep it.
Thanks. And I think you answered this a little bit, William, but are there other kind of specific pieces of data you think would be kind of helpful in the future that the dashboard will be kind of covering and that will be reported maybe publicly?
Well, reported maybe publicly, I don't know. I think that the department is kind of continually looking at adding stuff to its publicly available information. So I think that Unwinding kind of landing spot that Wisconsin has created, that's sort of along the lines of what Wisconsin's COVID dashboard is going to continually have more and more information added to it. That's my understanding. I mean, not certainly everything, but so hopefully that'll get better. As far as other information, I think that one of the things that, this is getting pretty far into the weeds, but one of the really cool things that this dashboard is tracking is the top 5 reasons that people were determined, who people were disenrolled for procedural reasons. And so we can really start to drill down and see that, okay, people aren't submitting this information or aren't responding, so we can really start to look at what that really means and how we could make system improvements. So it's even further, kind of a deeper dive than just looking at, procedural disenrollments.
And
there's lots.
If I can jump in here, Sashi, it's very frustrating. There's a list of some 80 performance indicators in Medicaid that CMS released in 2014, and only a handful of those data are making it to the public. What I don't understand is we keep talking about running government efficiently. There is no business that runs their business efficiently that doesn't use data to make informed decisions. And yet somehow our public coverage programs, it seems to be okay that we can do things and not tell anybody about it or what the outcomes are. The taxpayers pay for these programs, and we deserve to see the data, all of the data. So I'm pleased to see Wisconsin moving in that direction. SHADAC at University of Minnesota has a list of state dashboards. But honestly, I think at the end of the day that Congress needs to once and for all require state reporting of any number of metrics disaggregated by populations and require that to be reported on an ongoing basis or be penalized financially for not doing so. There is no reason. We talk a lot about transparency, but we need to put it into action.
Thank you so much, Tricia. And just want to put a note out there. Maziel has put the link in for the current public dashboard that the state has that William was talking about. That's a little bit similar to the kind of COVID dashboard that the state was providing. So if you kind of want to see some information in the public dashboard that's available right now, that is there. William, I think you alluded to enrollment assisters and outreach workers kind of talking to either their provider groups or their kind of member associations to maybe help them get access to information from this other DHS dashboard that you've been talking about. I think, as William said before, we're still kind of taking a look to see the accuracy of the information and working with the state work group to see what those reports might look like. So thank you, Maziel, for posting that here. Trisha, I think somebody was still a little bit confused about the how enrollment assisters could be able to kind of remotely help patients with their enrollment. I think you talked about a little bit about having that kind of, sorry, go ahead. I think you know what I'm talking about, hopefully.
Right, yeah. Oops, sorry. I'm on, sorry. So there in Medicaid, you can appoint an authorized representative who can then act on your behalf. In some states that have sister portals, and I haven't looked at Wisconsin recently, you have access to the individual's data for the third party authorized reps. And when you do that, if someone goes in and updates the information, it's attributed to the rep, not to the individual. So that's sort of a best practice in making sure that the state knows, did somebody just go in and change this data? Because when a beneficiary says, I never gave you that information, if you don't have that kind of protection in place, you won't be able to monitor it. But third-party authorizations is not something that sisters have been encouraged to do in the past, right? And the states that actually have these sister portals are a better way. And I think I misspoke before. I was really talking about the online account that belongs to the individual as opposed to the sister portal, because a sister portal can accomplish the same thing. So there are issues with signature requirements and things like that. So this authorized rep really is not the most expeditious way to allow sisters to report information on behalf of families. I mean, there are a lot of different mechanisms, but currently it is the only way that CMS is allowing.
Thanks, Tricia. And so 2 things. We have about 3 minutes left here. We will do one more poll, but I just want to ask William one more question. Tricia, you mentioned different provider groups, different member associations getting together and kind of having a consistent message to the state, and, understanding where those barriers are. William, what are your thoughts on that here in Wisconsin, of kind of pulling that work together?
I think Wisconsin's built a pretty robust system using the enrollment networks, kind of all the work groups and the task force. That being said, I think that I also believe that there are other working groups, like there's many organizations who have kind of their own stake in this, who have huddles and other things where they're sharing information and best practices. But I think that any opportunity for us to for advocates and others to be in the room with and understand kind of what's happening on the ground gives us all an opportunity to kind of work to make the system better and to advocate for changes. And advocates certainly play a unique role. And, like CCF, we also don't get a lot of government funding. And one of the reasons we do that is so that we can, advocate with the department, to make changes. And so certainly being able to have those advocacy strategies informed by what's happening on the ground is really crucial. So I would welcome it. It would be fantastic.
And if I can just add, I really think if you think about independent boards, you take your hat off, whatever hat you wear when you walk in that room. What happens when we silo this kind of advocacy? It becomes self-serving. This sector wants this to happen, and this sector wants this to happen. By coming together, you can compare notes and say, you know what? If we're worried about what's happening to children and families, these are the bigger issues. So instead focusing on my specific interest, we're going to focus on the interest of children and families.
Thanks so much. That's a great way to end our session. If folks can hold on for one more minute, Allison, if you want to do our one more poll. And then I just really want to thank William, Tricia, just what fantastic speakers and just a wealth of information. And thank you to CWI for having all of us on this panel today. And I know there's, as we said before, the slides will be shared. Encourage you to use those as resources. And Tricia has a great list of resources as well as you kind of continue to learn more about Unwinding and keep updated on it. Thank you all.
Wonderful. Thank you so much. And thank you also for answering this poll as we're closing out. But yes, thank you so much to Trish and William and Sashi. Such a wealth of information. We really appreciate you being with us today, taking the time and really focusing on what's happening here in Wisconsin around Unwinding and what kind of data we can have access to and to better understand that. We're taking a short break at this time. And we will be, make sure as you have been with the other sessions, you'll need to leave and then come back to join the new session for a second session of today. And so we'll be starting that at 10:45. So thank you again, and we will see you shortly.